All right, I'm going to start off by saying, and I should have paid more attention when they asked me to do this talk, because I didn't change the title, and it says preliminary results, and most of this stuff I'm going to present has been published, and it's no longer preliminary, but there is at least one slide that's preliminary. So our learning objectives today include understanding the relative risk for cardiovascular disease in adults with FASD, understanding that this doesn't happen in the absence of other lifestyle and environmental factors in mediating cardiovascular disease and outcomes, and understand the importance of early screening for cardiovascular disease. I hope the findings will have some public health policy outcomes. So this slide here sort of is a slide I've used for years when I train pediatricians about the risks for FASD and for the burden of caregiving. And I want to call your attention to the line that says cardiac, because it says simply benign heart murmurs are common, but most serious cardiac malformations do occur, but they're relatively rare. Most people who do clinical work with this patient population would say, yeah, they definitely are occurring in a greater frequency, but the research has been a little ambiguous. So I want you in your mind to help differentiate between cardiovascular and vascular disease. They're all interrelated. They're a part of a whole system that is pumping oxygen throughout your body. It's also important to think about the heart in its development and the vessels in their development phase versus the secondary effects that happen in life as you accumulate over time burdens from other exposures and things that impact your cardiovascular health. So we'll start sort of trying to separate out some of those effects. So in 2015, there was a meta-analysis that was done on the research on congenital heart disease to see whether or not there was an increased risk for congenital heart disease as a function of prenatal alcohol exposure. And the authors concluded, because there's not much deviance from the line that would reflect no effect, that there really wasn't a risk for cardiovascular disease or congenital heart disease at birth. So this is a study that just came out in 2022 that says just the opposite. And this study says, yes, there is an increased risk for cardiovascular disease or congenital heart disease. But I want to call your attention to how big the sample was. It was over 5 million records that were surveyed that showed this effect. And so we, for years, have talked about the iceberg of this condition. And I think this is the same thing with respect to understanding cardiovascular impact. So if we think about congenital heart disease, it's really that very peak of that iceberg. And I think we need to tease apart more of the other areas, including the vascular function, which I think has a big, huge impact and a lot of long-term impact for heart disease. This is a study that's a preclinical study, and I love our preclinical people in our field because they're really important in helping us understand things that are really confusing in human samples. And the one thing I really loved about this slide, this is a slide where they exposed animals to different dosages of alcohol and then imaged their vascular tissue and their cortex. And the top one are animals who are control, and you see sort of a weaving pattern for the vascular tissue there. And the second one down is an animal who is sort of a mid-dose range, and you can see the vascular tissue looks very different in that cortex. Now imagine if that's your oxygen delivery system. If you have an oxygen delivery system that has all those kinks and twirls, you can envision how hard it is to deliver oxygen to the brain tissue that you need to function. So in our clinic, we have a clinic that we have here in Atlanta, Georgia, and we see kids who are alcohol and drug exposed, and we diagnose some of them with a fetal alcohol spectrum disorder. And when we went back and looked at our data, we found that there was a 10-fold increased risk for hypertension after we controlled for their body mass, their ethnicity, their use of other medications. So again, another sort of factor that says, hey, there's a concern about what's going on with the vascular system here. So the Atlanta prospective cohort, mine is a subset of the cohort that Claire talked about that combined the Atlanta cohort and the Seattle cohort. And this study was only done in the Atlanta cohort, partly because we needed to have a cardiologist to be on board to do this study. So Claire recruited our sample when they were in utero and then manages to follow them all the way up until they're 40 years of age, which is quite phenomenal. I only got involved when they're in their teen years. I put up these graphics just on the pictures on the side just to give you an illustration of the sample. This was an inner city sample in Atlanta. They were born at Grady Hospital. The picture is Perry Home Projects, Atlanta projects were not a great place to live during the 1980s. And I put on there a couple cultural things to give you a context of how long ago this was. So you can see a map of pop culture things from the 1980s, which curiously enough, there are a lot of elements that are coming back for some reason. And I put on here an Apple computer, which was nowhere near as powerful as the little phone you have in your hands at the moment. But if in the 1980s, if you bought Apple stock at $5 a share, you'd be filthy rich now. So this is the cohort, and yeah, I can see better up here. This is if you look at the control group and the prenatal alcohol exposure group, I've highlighted some of the key differences. There are no differences in age. There are no differences in various socioeconomic factors. This is a very tight sample and that they're very similar to each other except for the prenatal alcohol exposure. And they differ in weight, which makes sense relative to FAS. We know that alcohol can cause reduced weight. But the other thing that's really important to look at here is the body mass index. And the body mass index reflects your weight relative to your height. And it's important to look here to see how at risk both our FAS sample is, or our alcohol exposed sample, but also the controls in the sample. So when I'm telling you about the results of this study, I'm not comparing this to a group of 35, 36-year-olds who are typical. These are individuals who grew up in a relatively impoverished world where there was food deserts, exercise deserts, all these things that would support good cardiovascular health. And you'll see on here, in our control sample, over 90% were classified by the CDC as being overweight. So when I compare the risks for our prenatal alcohol exposed group, I'm comparing it to a group that's already high risk for cardiovascular disease. We measured many different factors that are related to cardiovascular disease, so cholesterol levels, glucose levels, hemoglobin, and insulin levels. And the only one that was statistically significant just in comparison between the groups was triglycerides. And it actually was in the opposite direction in that the prenatal alcohol exposed group had actually lower levels of triglycerides than did the contrast group. And remember, this is a group that's 90% overweight, living in a world where there's a lot of challenges. So this is a study we published, one of the first ones we published out of the gate because the results were so striking and astonishing to me. I wouldn't have done insulin, it wasn't part of the original grant, but my cardiologist friend said, hey, you've got to do insulin if you're going to do heart disease. And I see a lot of people presenting on glucose, and I challenge you to try to assess insulin metabolism as well. So I'm going to explain this graph because it's really important. Does this thing have a pointer? Oh, good. So I'm sorry on this side. I'm doing it on this side. You see the insulin levels here and body mass index over here. And here, this mark here is the threshold for the CDC ranking for being overweight. And you see in red are all the prenatal alcohol exposed group. And again, these individuals here are fairly protected, and you don't see an increased risk for high levels of insulin. When we go up on the body mass index for the control group in blue, you see that sort of linear growth like there. So the higher your BMI is, the higher your level of insulin is, the more your risk is for diabetes. But look what happens to the FAS group when they cross into the category of just being overweight, not obese, just overweight. You see how dramatically their level of insulin metabolism goes up, suggesting an increased vulnerability to diabetes. So we then, in addition to doing that, which was just supposed to help me understand, and I thought it was a really important story, so we published it as soon as we could, we were really interested in doing these cardiovascular measures. So we have 4 different outcomes. One is your diastolic blood pressure, your systolic blood pressure, which are just the 2 measurements that you use, and then a thing called reactive hyperemia, and then another parameter called arterial stiffness. And what you see in the picture is what's called peripheral arterial tonometry, and it's this little device, and you have to put this little thing on your finger, and then they occlude blood the same way they do when they take blood pressure. And what it does is it gives you an index of it gives you an index of to what extent this vessel here is being occluded by plaque. Okay, so if you let me flip to the next slide. So here's sort of a model of what it looks like. You can see here there's a device on the finger. Here's the occlusion, and you can see then you have to open that back up, and then the blood comes flowing through. If you have a low score, you have increased risk for cardiovascular disease, and if you have a high score, you move into this green normal range. Okay, so when we're trying to understand all the complicated human things that go on, there are a whole lot of things that are impacted. So on this figure is just a correlation matrix, and 8 through 11 are the outcome measures, and 1 through 7 are factors that are associated or predictors. And you can see there's a lot of correlations, and so it's really confusing to make a mess out or to try to understand what is affecting what directly, what is affecting something else simply because of its relationship with something else. And so we use this technique called path analysis. So path analysis allows us to look at the relationship between factors by controlling for all these other relationships. So I'm going to skip this and skip systolic. And I'm just going to tell you simply the story with systolic is, with blood pressure, is that we did not see an effect of prenatal alcohol exposure that was adverse. It was actually protective through its effect on body mass index. So the heavier you were, the higher your blood pressure was. So here's the result for your reactive hyperemia, the extent to which your blood vessels were occluded. And we know triglyceride levels didn't differ, so it's probably unlikely that it really is the plaque buildup. It's probably more likely that the arteries are small, and that's why we're seeing this difference. But what we found was a direct effect of prenatal alcohol exposure on this, adversely impacting with less ability to transmit the blood, and then an indirect effect of dysmorphia through this path. Okay. Augmentation index is a fancy way to look at arterial stiffness, and here we had an effect of prenatal alcohol exposure, but it was an effect of prenatal alcohol exposure that went through dysmorphia. So there actually is a direct effect of dysmorphia on arterial stiffness, so making the artery more stiff. And then there's an effect through PAE through body mass index. Okay, so let me see if I can go back to that. Oh well, I'm going to keep going. And then here's some of the preliminary results. This is a relationship between that arterial stiffness measure and IQ, and the IQ was actually taken when they were teens. And so what we found was that in the alcohol-exposed group, this arterial stiffness measure was related to the IQ measures where it was not in the control group. So very clearly showing a differential impact potentially as a mechanism of how it's influencing brain development. So the conclusions are prenatal alcohol exposure increases risk for adverse impact to vascular function that predicts coronary heart disease. And the adverse impact of vascular function occurs in the context of other commonly known lifestyle and environmental factors, and those are important to try to control for if you have increased risk. And supporting harm reduction efforts by improving lifestyle and environmental factors that promote cardiovascular health should be an important health goal for individuals with an FASD. So the primary thing is early screening for cardiovascular disease and vascular function in individuals with FASD is a really important public health issue. These become even more important if the person with FASD is overweight. So there should be an increased concern because of the risk for diabetes, which adversely impacts cardiovascular health. So I want to thank NIAAA for funding this research, and this was sort of a buddy project to the CFAS project that was being done. And I want to thank my collaborators, Claire Coles and Pooja Meeta, the cardiologists.
every child with a congenital heart defect, regardless of whether they were exposed to alcohol or not, needs the genetic consultation, needs microarray, and needs exome sequencing. There are many children diagnosed with fetal alcohol syndrome that probably do have it, but in addition, they have a syndromic disorder. And so sometimes interventions for FAS may not work for your child if you're not properly diagnosed with the other part. Every child with multiple congenital anomalies or neurodevelopmental disorder really should be seeing a geneticist for both microarray and exome sequencing. And whenever we talk about prenatal alcohol exposure, we need to be talking also about the genetics involved in it.
I wholeheartedly agree. I will tell you from a practitioner problem is that insurances in our area will not pay for those assessments, and it can take 2 years to get to a geneticist. And so we have to fix some of those health constraints, because I think everybody who comes to our clinic should have a genetic analysis.
Hi, my name is Peggy Black, and this is Angel. We're both with the FASD Network of Northern California, and I want to talk about the import of research, the research that was presented today, as well as the adult survey information and your research findings regarding cardiovascular health and other health risks. How do we get this information out to the physicians out there who don't know anything about fetal alcohol spectrum disorder?
So we've been working hard for years to get pediatricians to understand. So and now we need a whole arm of education for family practitioners. And I think as this evidence compiles, we need to develop those kind of liaisons and relationships and begin training family practitioners who are seeing people out in the community and internists.
So this is a medically high-risk population, being in a medical home, but how do we get medical schools and current providers aware of these issues?
Yeah, I agree with that. Totally, we need to do it. We have a model that we've used for pediatricians, and we could definitely apply that model. It's not fully adequate, though. Clearly, we could be doing more, because even within children, it's hard sometimes to get somebody to understand FAS in your community.
It's kind of moving the research from journals out into the world.
Right.
All right, please join me in thanking the speakers one more time.